I see and speak to a lot of people every day who have new acute conditions, as well as doing a lot of home visits for patients who are sometimes too complex to come on into the practice. I've seen or spoken to over 1,000 different people here in the clinic. Not all those people I've seen in the clinic myself. I might have spoken to them on the phone and then booked them in, but many of them also I do see myself, because I do go through and look at those people that are calling in to see what I can see myself.
Certainly with the extended care paramedic, our management of acute problems or urgent problems has really taken off. Paramedic can do triage in the morning, can book in the afternoon to see patients, whether they be ACC, respiratory patients, and importantly, if we have a patient in the community who rings up in a seriously unwell and all the doctors are fully booked, we can send the paramedic out to do an assessment, liaise back with the doctor, and it often avoids an emergency department visit. So really beneficial, increases the efficiency in the practice and what we actually deliver and how we deliver it, reduces, I think, impact on the emergency department and hospital.
So there is quite a large workforce burnout for them in New Zealand. It's between 3.5 to 5.5 years. It's a very short time to actually keep somebody in the health sector who has just done several years of training, offer alternative positions, whether it's here in primary health care or in the public health space or in an immunisation space or in a telehealth space, helps keep those skills in the workforce. And a lot of our paramedics that move into primary care quite like that move into primary care for that work-life balance.
Keeping them in primary care, big, massive step forward, both in skill sets, what we can offer and support for the patient, and taking pressure off the hospital. Have to develop these roles in primary care and general practice. It's absolutely critical to what actually happens next. If these roles were to disappear, it would be a huge step backwards. It would add more pressure on the clinic, it would add more pressure on the staff here. It would certainly take a step back in terms of what we offer, the wraparound support for our very complex patients. And I suspect there would be an upswing in demand of unnecessary presentations to ED when these issues can be managed successfully in the community.
It is very important for primary health, especially the paramedic offer that service to improve the access of our patients. Support the wraparound service here, especially here at Cannons Creek. Our community need to be access, quality service and affordable.
It's not a replacement of GPs and nurses and other roles in primary care, but an additional set of skills that can help meet those acute care needs and utilising the extensive skills that a paramedic and ECP has.
Since they've been introduced into the clinic, they've become an integral part of our service delivery. If you talk to any staff member here, they want to see those roles continue.